Question 1. Which is the priority nursing action when a patient is experiencing an acute asthma attack? A. Administer corticosteroids. B. Encourage slow, deep breathing. C. Administer a short-acting beta agonist. D. Prepare for intubation. Answer. C. Administer a short-acting beta agonist. Question 2. What is the best position for a patient experiencing dyspnea to improve breathing? A. Supine. B. High Fowlers. C. Side lying. D. Semi-Fowlers. Answer. B. High Fowlers. Question 3. Which patient should the nurse assess first during shift report? A. COPD patient with a productive cough. B. Asthma patient with mild wheezing. C. Pneumonia patient with increased confusion. D. Patient with emphysema requesting pain meds. Answer. C. Pneumonia patient with increased confusion. Question 4. Which finding in a patient with a pneumothorax indicates improvement? A. Diminished breath sounds. B. Midline trachea. C. Increased chest pain. D. Decreased oxygen saturation. Answer. B. Midline trachea. Question 5. What is a common complication after a bronchoscopy that requires immediate attention? A. Drowsiness. B. Coughing. C. Hemoptysis. D. Sore throat. Answer. C. Hemoptysis. Question 6. A patient is admitted with status asthmaticus. Which medication should the nurse anticipate administering first? A. Inhaled corticosteroid. B. Oral theophylline. C. Methylprednisolone. D. Inhaled albuterol. Answer. D. Inhaled albuterol. Question 7. What is the most effective way to prevent influenza transmission in a healthcare setting? A. Wearing gloves. B. Taking antiviral medication. C. Annual vaccination. D. Limiting patient visitors. Answer. C. Annual vaccination. Question 8. The nurse notices a sudden drop in oxygen saturation during suctioning. What is the nurse's priority? A. Increase suction time. B. Stop suctioning and oxygenate. C. Continue and complete suction. D. Increase suction pressure. Answer. B. Stop suctioning and oxygenate. Question 9. Which is a late sign of hypoxia? A. Tachypnea. B. Irritability. C. Cyanosis. D. Restlessness. Answer. C. Cyanosis. Question 10. Which is the best nursing intervention for a patient with thick pulmonary secretions? A. Increase fluid intake. B. Limit physical activity. C. Lower the head of bed. D. Encourage shallow breathing. Answer. A. Increase fluid intake. Question 11. A nurse auscultates high-pitched wheezes in a client with asthma. What is the underlying cause? A. Air trapping. B. Fluid overload. C. Bronchoconstriction. D. Consolidation. Answer. C. Bronchoconstriction. Question 12. Which finding in a client using CPAP for sleep apnea requires immediate intervention? A. Mask redness. B. Dry mouth. C. Loud snoring. D. Claustrophobia. Answer. C. Loud snoring. Question 13. What dietary instruction is most appropriate for a patient with chronic respiratory disease? A. Eat large meals. B. High-protein snacks between meals. C. Avoid all carbohydrates. D. Increase caffeine intake. Answer. B. High-protein snacks between meals. Question 14. A client with asthma is prescribed a leukotriene receptor antagonist. What is the expected effect? A. Dilates bronchi immediately. B. Reduces airway inflammation. C. Prevents coughing spells. D. Clears mucus secretions. Answer. B. reduces airway inflammation. Question 15. A patient with tuberculosis is discharged. Which teaching is essential? A. Return for TB skin testing. B. Stop medication after 2 weeks. C. Avoid crowds and wear a mask. D. Keep windows closed at home. Answer. C. Avoid crowds and wear a mask. Question 16. The nurse is caring for a post-op patient who refuses to cough due to pain. What is the priority action? A. Document refusal. B. Educate on coughing benefits. C. Provide PRN opioid pain medication. D. Encourage deep breathing only. Answer. C. Provide PRN opioid pain medication. Question 17. Which assessment requires immediate action for a patient with a chest tube? A. Serous drainage in tubing. B. Continuous bubbling in suction chamber. C. Drainage greater than 100 milliliters per hour. D. Gentle titling in water seal chamber. Answer. C. Drainage greater than 100 milliliters per hour. Question 18. A patient recovering from pneumonia has clear lungs but a lingering cough. What is the best nursing action? A. Request antitussive medication. B. Encourage fluid intake. C. Apply warm compresses to chest. D. Limit ambulation to avoid fatigue. Answer. B. Encourage fluid intake. Question 19. A nurse reviews ABG, pH 7.31, PaSO 250, HCO3 24. What is the interpretation? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Compensated alkalosis. Answer. C. Respiratory acidosis. Question 20. What is the purpose of pursed lip breathing in a COPD patient? A. Increase oxygen intake. B. Reduce secretions. C. Promote carbon dioxide elimination. D. Prevent airway infection. Answer. C. Promote carbon dioxide elimination. Question 21. Which finding indicates a complication from thoracentesis? A. Increased breath sounds on affected side. B. Slight chest discomfort. C. Sudden shortness of breath. D. Serous drainage from insertion site. Answer. C. Sudden shortness of breath. Question 22. A nurse is teaching a patient with COPD about oxygen use. Which statement indicates correct understanding? A. I will set the oxygen flow rate to 6 liters per minute. B. I should use a humidifier with my oxygen. C. I can remove my oxygen while eating. D. I can sleep lying flat in bed. Answer. B. I should use a humidifier with my oxygen. Question 23. What is the priority nursing intervention after a chest tube is accidentally dislodged? A. Reinsert the tube immediately. B. Notify the healthcare provider. C. Cover the site with a sterile occlusive dressing. D. Elevate the head of the bed. Answer. C. Cover the site with a sterile occlusive dressing. Question 24. A patient with bacterial pneumonia is most likely to exhibit which symptom first? A. Hemoptysis. B. Confusion. C. Fever and chills. D. Bradycardia. Answer. C. Fever and chills. Question 25. Which intervention should the nurse delegate to an experienced, unlicensed assistive personnel, UAP? A. Suctioning, a tracheostomy. B. Assessing lung sounds. C. Assisting a patient to use incentive spirometer. D. Educating about inhaler use. Answer. C. Assisting a patient to use incentive spirometer. Question 26. Which clinical finding in a COPD patient should be reported to the provider immediately? A. Clubbing of fingers. B. Increased dyspnea at rest. C. Barrel chest. D. Pursed lip breathing. Answer: B. Increased dyspnea at rest. Question 27. A nurse is caring for a patient with an endotracheal tube. What is the priority assessment? A. Level of pain. B. Temperature. C. Tube placement and breath sounds. D. Sputum color. Answer: C. Tube placement and breath sounds. Question 28. Which of the following is the best indicator of airway clearance? A. Normal body temperature. B. Clear and equal breath sounds. C. Absence of cough. D. Pink nail beds. Answer: B. Clear and equal breath sounds. Question 29. A patient with pulmonary embolism is receiving heparin. Which finding requires immediate action? A. Hematuria. B. Mild epistaxis. C. Bruising on arms. D. Slight hypotension. Answer: A. Hematuria. Question 30. What is the purpose of an incentive spirometer after surgery? A. Loosen mucus secretions. B. Prevent pneumonia and atelectasis. C. Improve oxygen delivery. D. Prevent thromboembolism. Answer: B. Prevent pneumonia and atelectasis. Question 31. A nurse observes constant bubbling in the water seal chamber of a chest drainage system. What does this indicate? A. Normal function. B. Air leak. C. Clotted tubing. D. Pleural effusion. Answer: B. Air leak. Question 32. A patient with emphysema has a PaO2 of 58 millimeters of mercury. What is the appropriate nursing action? A. Start oxygen at 5 liters per minute via simple mask. B. Notify the provider immediately. C. Place in prone position. D. Continue monitoring as prescribed. Answer: D. Continue monitoring as prescribed. Question 33. What is a normal expected finding for a patient with chronic bronchitis? A. Respiratory alkalosis. B. Clear sputum. C. Productive cough for 3 months. D. Absent breath sounds. Answer: C. Productive cough for 3 months. Question 34. A nurse is caring for a patient with active tuberculosis. Which precautions should be implemented? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. Answer: C. Airborne precautions. Question 35. Which statement by a patient with COPD indicates a need for further teaching? A. I will drink plenty of fluids each day. B. I will use my rescue inhaler if I feel short of breath. C. I should avoid high-calorie snacks. D. I will rest between activities. Answer: C. I should avoid high-calorie snacks. Question 36. Which symptom suggests a life-threatening asthma exacerbation? A. Wheezing. B. Productive cough. C. Silent chest. D. Runny nose. Answer: C. Silent chest. Question 37. The nurse reviews lab results: pH 7.48, PaO2 28, HCO3 23. What condition is present? A. Metabolic alkalosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Respiratory acidosis. Answer: B. Respiratory alkalosis. Question 38. A nurse is caring for a patient after thoracic surgery. What intervention prevents atelectasis? A. Applying anti-embolism stockings. B. Administering stool softeners. C. Encouraging incentive spirometry use. D. Providing high-calorie nutrition. Answer: C. Encouraging incentive spirometry use. Question 39. A nurse auscultates crackles in a patient with CHF. Which order should be expected? A. Fluid bolus. B. Loop diuretic. C. Bronchodilator. D. Steroid inhaler. Answer: B. Loop diuretic. Question 40. A patient receiving high-dose oxygen therapy complains of nausea and muscle twitching. What is the nurse's best response? A. Reduce the oxygen flow rate. B. Encourage fluid intake. C. Notify the healthcare provider. D. Administer antiemetic. Answer: C. Notify the healthcare provider. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.